I'm going to call the hearing, this hearing of the Committee of Agriculture, Past, Present, Future of SNAP, examining state options, will come to order. I've asked Rick Allen to say a brief prayer for us. Rick?
Let us pray. Well, Father, we are grateful for our time here this morning. Lord, let us be mindful of your many blessings as we hear from these folks today that are going to give us the information we need to make wise decisions. Lord, we do pray that you would give us the wisdom and the influence to make the right decisions and to do what's right for this country. We pray for this country. We thank you for this body. We thank you for agriculture and blessing this land. In his name we pray. Amen.
Well, I want to welcome our witnesses to today's hearing and thank them for being here to continue our review of the past, present, and future of SNAP. This is our 12th hearing. Within this series, we've learned a tremendous amount about the complexities of SNAP and even more about the diverse individuals and communities that it serves. As we continue our review, we'll do so without preconceived notions and with a commitment to strengthen the program so that it can best serve families, most efficiently utilize taxpayer dollars, and empower states to effectively implement the program while protecting program integrity. Today, our witnesses will help us gain a better understanding of how the various options and flexibilities that states have in implementing SNAP. Through our review, we've learned that the SNAP varies greatly state to state and even vary within a state. While the federal government provides parameters for the program, SNAP statutes, regulations, and waivers provide state agencies with numerous policy options to adapt their programs to meet the needs of low-income people in their states. Certain options may facilitate program design goals, better target benefits to those most in need, streamline program administration and field operations, or coordinate SNAP activities with other programs for low-income families. When carrying out the program, states determine eligibility requirements such as income thresholds, asset limits, work-related requirements, and through categorical eligibility, states can utilize the participation from one means-tested program, such as Temporary Assistance to Needy Family, or TANF, to defer eligibility for SNAP. When calculating and issue monthly benefits for those eligible, states have the flexibility to determine the value of medical deductions and the standard utility allowances. It's important to note SNAP does not operate in a vacuum. When administering SNAP, states have a multitude of programs they are overseeing. As we will hear today, other programs such as TANF and Supplemental Security Income Program have an effect on how SNAP is administered within the states. It's important to look at how, as a collective whole, these programs are used by the people they serve. As we prepare for the next Farm Bill, this holistic understanding of the program will be important to make meaningful improvements. Understanding SNAP's interaction with other government programs and state agencies will help to utilize the effectiveness of the federal, state, and local governments as they administer SNAP. While it is important to empower states to employ the best policies to meet the needs of low-income families they serve, we as federal lawmakers must ensure the integrity of SNAP is maintained and not compromised by those administrative efficiencies. State flexibility can be an important tool in helping a family move out of poverty. However, the American taxpayer needs confidence that government programs are being targeted to those most in need. I look forward to hearing our witnesses today as we explore how to best leverage the relationship between state and local communities and to best serve recipients and utilize taxpayer dollars. With that, I recognize our ranking member for any comments he has.
Thank you, Mr. Chairman, for holding this hearing, and I'm looking forward to hearing from the witnesses. I've been urging for some time now that the committee take a look at the flexibility states have when administering SNAP. I understand that this is done to simplify the process, but I worry that it's gone too far and we have now too much leeway for the states. During the last Farm Bill debate, I offered a plan to reform categorical eligibility, and of course it didn't happen, but I still have a hard time understanding how states with both Democratic and Republican governors are allowed to exceed federal eligibility guidelines and then charge the federal government for the additional expense. You know, if we had a system like this, maybe we could balance the budget, if we could send the bill to somebody else. This creates a system where we treat people differently in different parts of the country, and I just don't think that's right. My district, for example, borders North Dakota. North Dakota and Minnesota have different income and asset tests to qualify for SNAP, so people, you know, in Moorhead, right across the river from Fargo, have a different situation, and I just think hard to understand why we're doing that. So I hope we'll also be able to take a look at the impact of of turning SNAP into a block grant, which I think, in my opinion, is not a viable option. I think it will only lead to the creation of an unaccountable slush fund for the states. Block granting SNAP has been supported by some in the past, but I hope we don't find ourselves on that path again. So again, I look forward to the testimony. Thank the chair, and yield back.
Thank the gentleman. Chair would request that other members submit their opening statements for the record so our witnesses may begin their testimony to ensure that there's an ample time for questions. I'd like to welcome to our witness table today Ms. Stephanie Muth, who's the Deputy Executive Commissioner for the Office of Social Services, Texas Health and Human Services Commission, Austin, Texas. Ms. Stacy Dean, Vice President of Food Assistance Policy, Center for Budget and Policy Priorities here in Washington, D.C., and Ms. Karen Cunningham, Senior Researcher, Mathematica Policy Research here in Washington, D.C. With that, Ms. Muth, you may start your testimony when you're ready.
Good morning, Chairman Conway, Ranking Member Peterson, and members. Thank you so much for the opportunity to be with you here today. And as the chairman said, I'm Stephanie Muth, and I work at the Texas Health and Human Services Commission, where my responsibilities include overseeing the Supplemental Nutrition Assistance Program and eligibility operations for our integrated eligibility system. And I wanted to start by providing you with a little bit of information about the SNAP program in Texas. We provide, on average, $435 million to 3.8 million SNAP recipients each month. Over half of the recipients in Texas are children, and just under 8% are over the age of 60. And like the rest of the nation, over the past 10 years, Texas has experienced growth in SNAP participation. States around the country have been challenged to work within our existing resources to meet the demands of this increased caseload while remaining focused on program integrity. To meet this challenge, Texas has pursued some innovative solutions that increase client self-service options and leverage third-party data sources. So clients' increased use of self-service, like our yourtexasbenefits.com website and a mobile app, allows our staff the time to focus on what their core responsibility is, which is verifying the information that's provided and making accurate eligibility decisions. The question posed to me was, how does Texas select which federal options to implement in the SNAP program? Well, there's not one answer to that, but in general, Texas selects options by considering state leadership direction, program integrity, business process efficiencies, and the impact on the rest of the programs in our integrated eligibility system. Our state leadership is actively involved and engaged in shaping and directing policies for SNAP and provides some direction through legislative actions. Texas values accountability and integrity of its publicly funded programs, so as a result, Texas chooses to verify most income sources and deductions such as child support and medical expenses, and we do maintain an assets limit that considers liquid assets as well as vehicle values. In addition to maintaining program integrity, Texas is committed to efficient business processes that reduce unnecessary client interactions while ensuring that we produce an accurate eligibility determination and provide benefits timely. We allow applicants to submit applications online, and we have waivers that allow on-demand and telephone interviews. And Texas also utilizes an electronic correspondence option so people can opt out of receiving mail and receive information from us through email and text. We consider the availability of resources that are required to implement additional state options or waivers in relation to the expected gain. Simply put, it's what kind of bang are we going to get for our buck? With limited resources, both staff and funding, we have to prioritize those state and federal mandates and also projects that will have the most impact when we're determining what to do. Texas has sought to align eligibility policies across our programs since we are an integrated eligibility state. We have aligned SNAP income and resources policies to mirror the state's TANF program. And although states have some flexibility in the administration of SNAP, we believe there are additional opportunities to improve program integrity and leverage technology to gain efficiencies. I'd like to outline 3 of those for you today. First, federal statute and regulations require that SNAP agencies accept an application with only a name, address, and signature. States are prevented from requiring any additional data elements to file an application, even an online application. Having the ability to require additional elements could strengthen program integrity in a virtual environment. It also could shorten eligibility processing timeframes, so we recommend some additional state flexibility in this area. Second, federal regulations require states to interview SNAP recipients at initial certification and at least once every 12 months at recertification. We recommend additional flexibility in determining when an interview is required. This would allow us to better deter fraud at the front end and to interview cases that are at higher risk because of the attributes of that case, like self-employment income, of an error or fraud. And lastly, federal regulations require states to expunge SNAP benefits from accounts that have not been accessed after 1 year. But some SNAP cases are active, but they have benefits as old as 12 months. This erodes the public confidence in the program. Why is somebody who's receiving SNAP still have the benefits from 12 months ago? So we recommend additional flexibilities in that area as well. And that concludes my testimony.
Thank you, ma'am. Ms. Dean, 5 minutes.
Chairman Conaway, Ranking Member Peterson, and committee members, thank you for the invitation to testify today. I'm Stacy Dean, Vice President for Food Assistance Policy at the Center on Budget and Policy Priorities, a nonpartisan policy institute located here in Washington. I'm really pleased to have the opportunity to talk to you today about state flexibility in the Supplemental Nutrition Assistance Program, or SNAP. I've worked on the program for more than 20 years, and one of the most rewarding parts of my job is the opportunity to work directly with state officials to improve the program at the local level, including helping them to understand the flexibilities available to them. SNAP is the nation's most important anti-hunger program. It currently helps 45 million low-income Americans to afford a nutritionally adequate diet. It has powerful short and long-term impacts on low-income families and individuals. It helps families and communities weather tough times. It reduces poverty and food insecurity. It improves health and supports work. The program has been proven particularly important to families with very young children, having lasting impacts on their health and development. SNAP's success can largely be attributed to its national entitlement structure, its relatively uniform eligibility standards, its basic standards for program administration and integrity, and the fact that it's a food-based benefit. Although it's a national program, states administer SNAP and are a key partner in the program's success. States absolutely need some flexibility in SNAP because they operate it within a larger health and human services system, as you've just heard from Ms. Muth, and that can include Medicaid, child care, cash assistance, and other programs. So let me just highlight a few areas of flexibility that I covered in my written testimony. First, states can tailor the look and feel of SNAP to their health and human services systems, and we just heard about a few in Texas. The amount of SNAP benefits that similarly situated families receive across 2 states really is very consistent, but how they engage with and experience the state agency can be quite different. Some states emphasize online services or in person or both. Some commit to process benefit applications within hours. In other cases, it will take weeks. Some provide a comprehensive set of services through a single caseworker, and in other places, families are asked to go to multiple places and fill out redundant paperwork. These are all choices that states have. Second, the states have special flexibility to improve service delivery to the working poor. After the passage of the 1996 welfare law, states began to see that some of states' rules were impeding their ability to connect eligible working families to the program. And as a result, Congress, through the Farm Bills, provided new state options designed to allow states to service working families. And these flexibilities have made a difference. States now serve close to 3/4 of eligible working poor families, versus about less than half in the late 90s. And finally, states can test new ideas. USDA can waive certain SNAP requirements to test whether a change would be in the program's interest. Now, I believe the department is appropriately cautious about allowing unproven sweeping new changes into the program that would compromise program integrity or program access. Nevertheless, USDA does work with early innovator states, and I would put Texas in that category, to test new ideas. Overall, I really think Congress and USDA have struck a reasonable balance in maintaining SNAP as a high-performing national program while providing states with needed flexibility. States' requests for more flexibility really have to be weighed with other considerations. Most notably, the program is highly effective at protecting vulnerable people from hunger and hardship. So state variation has to be carefully considered as to whether it will help the program meet that basic need or put struggling people at greater risk. SNAP is fundamentally a food assistance program, and how it assesses what's a household and how that household's ability to purchase food for itself is just necessarily different than how we might measure the same group of people's ability and obligation to, for example, cover health insurance costs or child care for each other. Federal SNAP rules require the highest level of rigor for any major benefit program with respect to assessing applicants' eligibility and determining benefits. Many states' requests to change rules might save them time or burden, but would chip away at these very exacting standards. So I absolutely appreciate your desire to strengthen the program and this hearing process. As you assess suggestions for further flexibility or modifications to the program, we encourage you to ensure that those proposals not undermine SNAP's strengths. Proposals to sweep away some of the program's key features or that would shift benefits away from food would run counter to the program's goals and proven success. Block grants, cap funding, or merged funding streams all would eliminate the most important feature of SNAP, its national entitlement structure. Similarly, proposals that would weaken or deter access or weaken the program's strong focus on integrity would also compromise its current success. Any of these types of changes to SNAP structure must be avoided. Thank you.
Thank you, Ms. Dean. Ms. Cunningham, 5 minutes.
Thank you, Chairman Conaway, Ranking Member Peterson, and members of the committee for the opportunity to testify on state options in SNAP. Today, I'll demonstrate ways in which SNAP quality control data can be used to analyze the effect of state policy options on the SNAP population. These data are derived from the monthly quality control reviews that states conduct on a sample of SNAP households. I'll focus on what we know about how state options regarding SNAP eligibility and time limits affect SNAP participation. I'll conclude with some thoughts on opportunities to continue building the evidence base to inform decision-making on SNAP. One key policy option available to states is the use of broad-based programs to extend categorical eligibility to households receiving a non-cash TANF-funded benefit. States may use this option to increase the number of people eligible for SNAP and streamline the eligibility determination process. Although categorically eligible people are not subject to SNAP income and resource limits, benefits for these households are determined under the same rules that apply to other households. As a result, only those with income low enough to qualify for a benefit or that qualify for a minimum benefit actually receive one. 39 states, the District of Columbia, Guam, and the Virgin Islands have established broad-based categorical eligibility programs. They have some flexibility in setting the eligibility criteria for these programs. 13 use the SNAP gross income limit for households without an elderly member or a member with a disability. 28 implemented a higher gross income limit for those households, and one state allows households with a child to have a higher gross income limit. Most of these programs do not have a resource test, while 5 states impose resource limits that are higher than the SNAP limits. We estimate that in fiscal year 2014, 8% of SNAP households were eligible solely through state-expanded categorical eligibility programs. Specifically, SNAP quality control data indicate that 3% of SNAP households were eligible through higher income limits. Less than 1% of all SNAP benefits went to these households. Their average monthly benefit was $58 compared to $260 for households that passed the SNAP income tests. Using supplemental data, we estimate an additional 5% of SNAP households will not have passed the SNAP resource test. States also make choices regarding work programs and time limits. Many non-elderly adult participants are subject to SNAP work requirements. Certain groups are exempt, such as people working at least 30 hours per week or caring for a young child. Participants who are subject to the general SNAP requirements, under age 50 and not living with children, must fulfill additional work requirements, such as participating in a qualified employment and training program. Those who do not comply are subject to time limits on SNAP receipt. States are allowed to provide exemptions to the time limits for up to 15% of their caseload subject to time limits. States also may apply for waivers from the time limits for participants living in areas with a high unemployment rate or an insufficient number of jobs. Currently, 7 states, the District of Columbia, and the 2 territories are approved for a statewide time limit waiver, and 27 states have waivers for certain areas. The SNAP quality control data show that the majority of SNAP participants do not fit the criteria for being subject to work requirements. In fiscal year 2014, 88% of SNAP participants were exempt, most because they were children, elderly adults, or individuals with a disability. Among those who were subject to work requirements, only 1/3 potentially faced time limits because they were not participating in an employment and training program or otherwise fulfilling the additional work requirements. The majority of those facing time limits received a state exemption or were in a waiver area. In all, just over 200,000 individuals a month were not meeting the work requirements, and so were receiving time-limited benefits. One of the tools that USDA uses to examine categorical eligibility, time limits, and other state options is microsimulation modeling. Additional sophisticated data sets and tools could further advance the use of evidence in decision-making about SNAP at both the state and federal levels. An example of a new resource is the data sets being created by the Census Bureau in cooperation with USDA and states that link state SNAP administrative data to survey data. Moreover, new analytic tools such as rapid cycle evaluation can help states determine whether the policy options they put in place have the desired effect on program access, administrative costs, and benefit accuracy. As Congress continues its full-scale review of SNAP, sophisticated data and tools can lead to more informed decision-making and a new perspective on the populations that the program is intended to help. Thank you.
Well, thank our witnesses. The chair would remind members they'll be recognized for questioning in order of seniority for members who were here at the start of the hearing. After that, members will be recognized in order of arrival, and I appreciate the members' understanding. Recognize myself for 5 minutes. Ms. Muth, in implementing the category eligibility, states have the flexibility to set the gross income limits up to 200% of poverty. Texas has set an income limit of 165% of the federal poverty level. Can you walk us through some of the factors that Texas used to determine that particular level?
Absolutely, and I also just want to add that Texas does apply the assets limit of the $5,000 as well to this population. And in Texas, this was an example of a change that came out through a legislative direction. So we did have state legislation in the early 2000s that directed the agency to implement the policy and defined the level at which it would be implemented.
So it's a state statute that sets the limit at 165 and the asset test at 5,000?
Correct.
Any sense of what the legislature, were you around when the legislature went through that exercise?
I actually was not. This was an exercise in research that I got to do in preparation for today to pull up the legislative history.
All right, Ms. Cunningham, speaking of that asset test, you said there are 5 states that currently oppose them, somewhere between $5,000 and $25,000. What is the benefit for a state to not test assets when it determines SNAP eligibility? And could waiving this test hurt the integrity of the program? You need your mic.
So, interesting question. The states can benefit by waiving the resource test. It means they don't need to collect any information on resources. So there's an administrative burden that's lifted there. There's not enough data currently to know whether that's the appropriate balance between administrative ease and other policy options. We don't know the asset holdings of current SNAP participants. With better data, we would be able to determine whether that correct balance has been struck.
All right, you said there are approximately 1.5 million households that do not meet, Ms. Cunningham, do not meet the federal income requirements, and that they average about $58 a month for the benefit. That's about $87 million a month. Is that an accurate statement?
Correct.
Okay. All right, I'll yield now to Mr. Scott for 5 minutes.
Thank you, Mr. Chairman. First of all, I think it's important for us to note that there are 1.7 million veterans that depend upon SNAP. And this is according to the CPBP, which is the Center for Budget and Policy Priorities. In every state, thousands of struggling veterans use SNAP to put food on the table. Low-income veterans, many unemployed, some working in low-wage jobs, many disabled, and on top of that, many who are returning from military service return minus a leg, minus an arm, mental problems, and they face serious challenges in finding work. But 1.7 million should gravitate this nation to realizing this is more than a national crisis, it's a national disgrace. And so it is very, very important that we recognize this as one of the primary challenges that we face. Stars and Stripes reported that food purchases paid for with SNAP at commissaries tripled from 2008 to 2011. Feed Our Vets, a nonprofit group that establishes food pantries for veterans, has estimated that nearly 3 million veterans and their families don't get enough food to eat each month. This is devastating. SNAP is a critical support for our heroes. And it's very important that we understand how important SNAP is. I also want to call attention to this committee that the Farm Bureau has an excellent program called the Patriot Project. It is a mentorship program that connects military veterans, beginning farmers and ranchers with experienced Farm Bureau members who are farmers and ranchers. This way, veterans who want to be involved in agriculture will be able to learn firsthand from an experienced farmer. This is a creative approach to that, much like many of us here in Congress are doing to reach another group, the African Americans, with our 1890s, to increase the opportunities for young students to be able to get the kind of scholarship and aid to go into agriculture and into business. I say that because we got to do a better job of lifting agriculture up to the significant level of importance it is. And no statistic emphasizes this more than 1.7 million veterans and their families depending upon it in the struggle. So I wanted to mention those in my opening. I got a minute left. So, Ms. Stacy Dean, you work with the Center of Budget and Policy Priorities. Much of the information that I just mentioned comes from you. In your testimony, you mentioned that Congress and the policy of Congress must not do things to undermine SNAP success. What things might you be talking about? Would block grants be one of those?
Yes, Congressman. Our organization would be deeply concerned if SNAP were converted to a block grant. So if its funding were capped and couldn't respond to need, I believe the ranking member used words I wouldn't, but I called it an unaccountable slush fund. It's a little strong, but that is in fact what we've seen in TANF. And of course, it's a shrinking pool of funding available for states to meet the needs of poor children and families. So that would be of deep concern. But also, I would imagine for this committee, the ability to divert benefits away from food to other purposes, which we've also heard about as an idea, would be of deep concern to us.
Thank you, Mr. Chairman.
Gentleman's time expired. Mr. Goodlatte for 5 minutes.
Thank you, Mr. Chairman. I appreciate your holding this hearing, and I just want to say at the outset that unless we reform programs like the SNAP program and a number of other entitlement programs, there is going to be a shrinking supply of funds for all of these programs, given the fact that we now have $500 billion to $1 trillion annual deficits totaling a $20 trillion national debt. But Ms. Muth, I wanted to ask you a question about Texas. You mentioned that your state has shown interest in photo IDs on EBT cards. Massachusetts and Maine have implemented this option to certain levels of success. What have been some conversations around this option?
So during the last legislative session, we had a proposal, and there's continued interest. During the last session, it did not pass. I think one of the barriers is that there is a cost to implement that. There's a cost to have that photo ID on each of the cards. And so I think members of our legislature are watching very closely the experience in states that have implemented it. The other issue is that the retailer at the point of sale does not limit purchases to the individual that's pictured on the card. And so the impact of having the photo is more of a deterrent, a potential deterrent effect, which is also difficult to measure in that cost-benefit analysis of, is that something that we want to invest in Texas? But there does continue to be interest, and we are watching the experience of those states closely.
And you indicate in your testimony that Texas has implemented an identity verification process in the online application, but due to federal restrictions, the applicant has the option not to complete it. Can you elaborate on what federal restrictions are in place preventing states from seeking more complete online applications?
Absolutely. There's a provision that requires us to count an application as filed with the state with only the elements of name, address, and signature on that. And the thought behind that is that file date is when the benefits start for the individual if an eligibility decision is made. But when you're in an online environment, first of all, in Texas, we have a lot of people that have the same name, so it's very difficult to identify somebody by just name, address, and signature. So I think we would like to have that ability. There are, and the federal citation is there in the written testimony. I think there's a happy medium of you don't necessarily need people to complete every element on a lengthy application, but we could require additional elements that would help us make sure we validate identity, just like we do for an individual who applies for a bank loan. You ask questions based on third-party data sources to confirm the identity, because we're not seeing these people in our office. And so I think
Let me ask a question, Ms. Dean, about this. So many states are now utilizing, in fact, a majority of states are utilizing online applications and over-the-phone initial interviews. Why are the states heading in this direction, and what has been the outcome as states have made their way to this model?
Well, two reasons. First is the technology is there, that it's workable and can help support states' business efforts. I don't think 10 years ago or 15 years ago the technology would have allowed states to take online apps the way that they are. And second, the recession really drove states to innovate, to find ways to do more work, given that so many more families were at their doors with less. And it's not just online applications, it's document imaging. So if all documents are scanned, that means that you don't just have to work with an office or a unique caseworker who's got your paper file. You can call, and wherever the available work resources in the state, your work can be diverted to them. So states are getting very innovative. I will just say on identity proofing, a back-end option to validate identity in order to reduce verification burdens on clients, I think is really interesting. In Texas and Florida, testing that is terrific.
Let me ask Ms. Cunningham. I understand the administrative efficiencies that can be obtained through the use of categorical eligibility. However, nearly 4 million people are eligible for SNAP through these policies that do not meet federal requirements. Are there ways in which we can retain these administrative efficiencies while more closely aligning these policies with federal requirements? And I'll ask Ms. Dean to respond to that as well as Ms. Cunningham.
I'll answer again that that's difficult to know without more data. Right now, it's hard to determine whether we've struck the correct balance. So I will say that people who are actually receiving a benefit are meeting the certain benefit criteria set by the federal government. So people need to have low enough income to receive a benefit. However, if you're interested in looking at their resources, we need more information to know whether we're striking the right balance on that. What's interesting is that states have chosen a variety of options. Of the states that have chosen broad-based categorical eligibility programs, 5 of them do impose a resource limit. Of the states that aren't, 7 of those states actually don't count the value of all vehicles. So there is a lot of information out there. Be interesting to talk to states, find out why they made the choices they did, what administrative costs they avoided or incurred that way, and what the results were.
My time has expired, but let me just say that it's easy to make decisions when it's the federal government that has to come up with the resources to pay for it. Thank you, Mr. Chairman.
Chairman's time has expired. Ms. Fudge, 5 minutes.
Thank you very much, Mr. Chairman. Thank you all for being here today. Ms. Dean, in your testimony, you mentioned that most states do choose to operate SNAP's 3-month restriction on ABODs as a time limit where individuals are cut off from assistance despite their willingness to work. You characterize this as one of the harshest options within the SNAP program. Can you please just explain a little bit?
Sure. So first, I would say the federal statute obligates states to impose a 3-month time limit on individuals between the ages of 18 to 49 without children. They have to work, and I should say it's not, they have to be working 20 hours a week. So working 18 hours a week, you'd still be limited to 3 months of benefits. States have an option to waive the rule in areas of high unemployment within their state. So, and every state except Delaware at some point since the rule's origin has waived out part of this, their state, for example, because very high unemployment and aren't able to, they don't believe that individuals there could legitimately find a job within 3 months. Another quick reason why they waive out is the work test that Congress, and I should say not this committee, it arose as a floor amendment in the 1996 welfare law. The work test that is set for those individuals is quite extreme. It's a 20-hour-a-week slot, and job search does not count. Most states don't have the funds available to create work slots for these folks, and they don't, and therefore it is a time limit. Often they'll waive the rule because they want to create a more meaningful work engagement for these folks to actually test their willingness to work and help build their skills. In your own state, unfortunately, I know the city of Cleveland qualifies for a waiver due to its high unemployment, but surrounding Cuyahoga does not, the county does not. And as a result, the state, even though you're a county-administered state and a lot of authority is devolved to counties, made the election for Cuyahoga not to waive the city of Cleveland.
Right, so, but you would think then, since you know a little bit about my state, that 75% of all of the minorities in the state live in our largest counties, like the cities I represent, Cleveland and Akron. However, when the governor sought a waiver, he only sought it for rural communities. Does that make any sense to you at all?
Well, I think the way I interpret the state's choice was that they only sought waivers for the entirety of counties. I know that Lima, Toledo, Dayton are also cities that qualify, but the governor chose not to waive out those cities because he couldn't waive the entire county.
So he was looking more at land than at people.
I can't speak to his
I mean, it just doesn't make any sense. We want the states to have these authorities, but then the states make decisions that are not based upon the highest need.
Right. And of course, if the county was able to waive individuals in the city versus the balance of the county, there could be an administrative reason not to do it, but I think in the case of Cuyahoga, that wasn't the case.
So that's why I'm so afraid about doing something like block granting SNAP to states, because they make those kinds of decisions. It's interesting to me that we look at ABODs as the least deserving among the poor. We really do. We put them in a category that's almost separate and apart from everybody else that receives SNAP. Your organization has estimated nearly 1 million people will be cut off SNAP as a result of these time restrictions, these limits. Describe the unique realities of what we're doing when we put 1 million people off of SNAP.
Right, that's this year in 2016, at least 500,000 and potentially up to 1 million individuals will be cut off the program as a result of this time limit. This is an extremely poor group. While on the program, their incomes are about 20% of the poverty line. They have very limited education. Many of them are working, but they're not working 20 hours a week. They have no other form of support. There is no cash assistance. Half the states don't offer medical assistance to them through the Medicaid expansion. And they just face extraordinary barriers. One group I would call out are ex-offenders. Of those with a felony conviction will face enormous barriers to entry into the work. And so taking away their food assistance doesn't make it easier for them to find a job and potentially risks their positive reentry.
But the other problem is that we have so many restrictions on what ex-felons can do. Most ex-felons can't even come to most states and get a license to cut hair or to do anything else that they are probably capable of doing. Mm-hmm. So we make it more difficult for them to find work based on all the restrictions that we put in law. Thank you very much, Mr. Chairman. I yield back.
Ladies, yields back. Mr. Lucas, 5 minutes.
Thank you, Mr. Chairman. Ms. Muth, let's continue along with the discussion that's been going on here with my good colleague from Ohio. My understanding is Texas has pledged to offer a qualifying work slot in 2016 to every able-bodied person without a disability, of course subject to the 3-month time limit, which is obviously a very noble and impressive goal. And I assume this is accomplished through your SNAP E&T program. The National Commission on Hunger's report discussed the complex rules covering E&T and recommended easing those rules to give states more flexibility to find work and work-related things. Visit with us for a moment. Have you found the current rules to be big challenges in accomplishing Texas goals? And what's your perspective on more flexibility?
I should clarify one thing. In the state of
Please.
Texas, we have a unique arrangement in that we have an entire agency, the Texas Workforce Commission, that is focused on all of the employment services. And so they actually administer the SNAP E&T program. So I can't offer you my opinion on that particular issue, but I would be happy to follow up with my sister agency and provide their perspective on that question.
So your observation looking across the bureaucratic way, how has their success affected the number of people in your program?
You know, it's very difficult for me to respond to that question. I think they've been extremely successful in assisting people in finding employment services across the various programs that we interact with them on, from both TANF and the SNAP program. But it's just not an area that I have any direct knowledge with.
Absolutely. For a moment, Mr. Chairman, I'd like to note my colleagues' concerns about block granting the programs. Being one of the members on this horseshoe that's been around for a little while, this was a major discussion in 1996 in the Farm Bill. And at that time, in that unique environment, it almost happened. But the chairman at the time made the decision, as my memory serves me, sitting on this committee way down there, not to proceed. And that's the only time that it's really ever almost come to fruition, a very long time ago in a different kind of an environment. But clearly, until we get the national economy moving forward and more opportunities exist, the necessity for these programs are going to exist. And with that said, I realize every state implements its standards a little differently. Texas at 165% of the poverty level, Oklahoma at 130. We have a different perspective there. As the good lady alluded to earlier, different asset requirements in Texas than in Oklahoma. That was one of the issues in 2012 that the lady and I worked on, was trying to standardize a few things, and received great pushback from a variety of directions and was not accomplished. But reform is necessary, and making sure the good folks benefit from the programs, are not subjected to the programs, is ultimately our goal. And with that, Mr. Chairman, I would yield back.
Gentleman yields back. Mr. McGovern, 5 minutes.
Thank you very much, and I'm sorry the gentleman from Virginia, Mr. Goodlatte, left because he suggested we need to reform this program because of the deficit and all of our budgetary problems. I want to remind him that SNAP is one of the most efficiently and effectively run programs in our federal government, with one of the lowest error rates of any program. want to deal with the deficit, maybe we ought to talk about reforming the Department of Defense. Some of their contracting practices, quite frankly, leave a lot to be desired. But we're talking about food. This is what this is about. And the idea, the notion that we're going to impose more requirements, more hoops for people to jump through in order to somehow lower the number of people who can take advantage of the SNAP program, to me is cruel. The gentlelady, Ms. Fudge, talked about the ABOB situation. I mean, we're talking about veterans in that category too, people who fought for our country, and because they're single adults and they can't get enrolled in a worker training program and they can't find a job, we're going to throw them off a food benefit. I can't think of anything more cruel and more ungrateful than that. And so when we talk about reforming the program, what we ought to be thinking about is how do we make sure that people in this country who are needy have access to this benefit. And by the way, the gentleman from Virginia mentioned the driver's license, the photo ID program. I'm from Massachusetts. Believe me, it's expensive and there are lots of problems and it's caused lots of confusion. So if anybody's thinking of going down that road, I'm happy to talk to you about some of the problems. But this is our 12th hearing on SNAP since the start of last year. And we've heard the word flexibility thrown around. That's the favorite word around here. And I worry about what that really means. It means one thing to me. It means something else to some of my other colleagues. I worry that it is code for block grants. I think that would be a disaster. I think it would be catastrophic. Block granting or cap funding or merge funding, whatever you want to call it, would be a mistake. It would undermine one of the fundamental strengths of the program, which is that it can respond quickly and effectively in times of great disaster or economic downturn. If you want to get people off of SNAP, then we ought to get this economy going. We ought to make sure that we're investing in job training, that we're investing in jobs. Maybe we ought to be talking about raising the minimum wage to a livable wage, because the majority of people on SNAP who are able to work. I mean, some of them are working more than one job, and they're earning so little that they're still in poverty, and they still have to rely on this benefit. What the hell else do we want them to do? Now, having said all of that, I should also remind people that the benefit itself is woefully inadequate, $1.40 per person per meal per day. I mean, the way sometimes we hear it talked about here, you think that it's the most overly generous benefit that you could possibly imagine. Now, I understand that states already have a number of options available to them that they can use to make sure that everyone who is eligible for SNAP is enrolled. But the problem is that many of the states aren't even aware of these options and don't take advantage of them. So there is already flexibility within SNAP to help states enroll eligible families to feed the hungry. But Ms. Dean, maybe in your testimony you elaborated on the options and flexibility that already exists. Maybe you could identify one or two of them most important but underutilized options.
Sure. Thank you, Congressman. I think a recent option that's been made available that states aren't necessarily aware of because it crosses over SNAP to Medicaid is that in Medicaid, when a family is up for renewal, the state's actually supposed to look at available data that it has first before asking the family in order to determine whether the family stays eligible. They actually have the ability to go into SNAP records and say, based on that robust assessment of eligibility and all the data that we have on who this family is and where they live and what they're earning, we can use that in order to, as Ms. Muth said, use third-party information to just automatically renew their Medicaid. And automatically, I want to make sure folks understand, there's a high degree of rigor there. But importing that information over ensures continuous coverage in health insurance. And given the extraordinary overlap between SNAP and Medicaid, those are the two programs with the most overlap. Finding ways to do more there is really important. But I think that our issue there is that FNS, as part of USDA, and CMS, as a part of HHS, are not always cognizant of each other's programs, and they don't always know how to engage states. Actually, Ms. Muth and I were having coffee this morning and talking about that very problem, that there's a lot of experimentation in service delivery in Medicaid that FNS isn't always aware of and might be more cautious than their sister agency. I think another area is senior service. There is actually an obligation on the Social Security Administration to help low-income seniors apply for SNAP at Social Security. And my assessment is that they are not doing as much as they could to help poor seniors apply at SSA and therefore not have to go down to the local welfare office. And I would love if the committee would consider exploring that issue and how to improve service to seniors.
Thank you very much.
Members' time's expired. Mr. Yoho, 5 minutes.
Thank you, Mr. Chairman, and I appreciate you all being here, and I want to thank everybody for taking the time to come here today and provide your testimonies. What I'd like to focus on is the issue of how states can further crack down on the SNAP fraud and abuse, and I'll talk about this and clarify this. In my home state of Florida, concerns have consistently been voiced by leaders at the Department of Children and Families that while there is a significant qualitative data on fraud, it's virtually impossible to quantify. And then I just want to echo what Chairman Goodlatte comments in regards to our ensuing financial crisis that somehow we seem to ignore up here. And knowing that about 80% of the 2014 Farm Bill is dedicated to the nutritional programs, what I'd like to hear from you is the best ways we need to reform, not just the nutritional program, and we're looking at all programs and not just in ag, but across the board, because this is a situation, as he pointed out, we're not going to have a choice. It will not be an option in 4 or 5 years if we don't address it now. And in the state of Florida, we talked with our people that administer this program, and they put in the work requirement, as you know, 1st of January. From January to the end of February, the people that were on SNAP that had work requirements instituted at the beginning of the year, less than 8% have re-signed up for the SNAP programs. And then we look at what happened in Maine, and 85% of their enrollment went down. And we know what happened in 1996 when Bill Clinton reformed the welfare programs. It was the largest drop in our history and the largest reform, and it was because of the work requirements. And I guess my question is, Ms. Muth, can you speak of the issues? That's not the question I had for you. Have you heard of any state or in your state, have there been any detrimental effects from work requirements for SNAP on the individual or a family?
So again, I'm not, in our agency, we don't administer the work requirement piece, but from the eligibility side, I'm not aware of any issues. And if I may, can I speak a moment to your issue of fraud? Please. Because I do believe that states, just like in the private sector, you know, there's a wealth of information that's available. If your credit card is compromised, your credit card company knows immediately that there's suspicious purchasing activity before you do in most cases. And really, we have an opportunity, and states are doing more and more of this, to apply those same technological skills and use that same technology like on EBT purchases. So when you see patterns that are potential fraud, that it will alert the state that we need to investigate, not just at the individual level, but also at the retailer level. And so I think technology opens up so many tools in preventing and detecting fraud that we are beginning to utilize more and more.
Let me ask you that, since you brought that up. Who would be best to do that? Would that be state, or is that something that should be farmed out to a credit card company or somebody that can do that, and they do it efficiently, and they do it right now, real time?
So in the state of Texas, we recently went through a new procurement for our EBT system, and that's one of the tools that we're getting, and it is a financial company that is going to be our EBT vendor. So it's the same technology that they're applying. Obviously, the patterns are different, the algorithms are different.
Right.
But it's the same technology, so they come with that expertise.
I appreciate your input. Ms. Dean, let me ask you, since you're on a national scene, let me ask you that same question. Have you heard of anybody that has been required to have the work requirements, and we've seen the results in Florida? Granted, it's only been 2 months, and I'm sure more people will sign up. But with like the state of Maine, where you saw an 85% reduction, or going back to 1996 under Bill Clinton, when he enacted the welfare reform, are there any reports that show the detrimental effect on an individual or a family? And if so, can you state those and give me maybe written testimony on that?
Sure.
Or direct me in the right direction?
Absolutely. I think that The concept of a work requirement, I share the congressman's, and the center has always believed that work requirements are very reasonable. The question is whether what we're asking of the individual is something that they can do, or when they don't comply, is it because they failed to comply, or is it because they refused to comply? And I think that that's where we often see an extraordinary mismatch between we ask someone to do something they're simply not capable of doing, and then they face the penalty because we made a mistake.
Okay, I'm out of time and I need to yield back, but I also asked them about the work requirement. If you're looking for a job, they said that does qualify for the work requirement in our state.
I can follow up with you. It does in January, it won't in April.
All right. Gentleman's time has expired. Mr. Aguilar, 5 minutes.
Thank you, Mr. Chairman. Ms. Dean, I appreciate the data that you shared with us today about the benefits of the program over here. Sorry. Unfortunately, some like to portray the SNAP program as a federal benefit that incentivizes low-income individuals to support themselves through federal funds rather than seeking employment, and I think the data shows that difference. However, I've always believed that the SNAP program is a federal benefit that serves as a bridge to help families out of poverty. Your research demonstrates some of the incredible outcomes in the program, and in your written testimony, you cite evidence that demonstrates caseloads for SNAP are declining as the economy improves. Additionally, the data shows that the SNAP program helped keep millions out of poverty, including 4.9 million children in 2012. So looking forward, how do you foresee the SNAP program evolving as economic times continue to improve, and what role will SNAP play in building a more financially stable future for low-income families? I'm interested especially on the economic side, which your data shows every dollar of increased SNAP benefits results in $1.70 in economic activity.
Sure, thank you. Well, as the economy improves, and most importantly, as poverty declines, we have seen elevated poverty despite an improving unemployment rate. The number of people who qualify for SNAP will go down, and as a result, we'll see a decrease. SNAP caseloads have been declining, albeit slowly, for the last 2 years, but preliminary data from the last few months suggest actually it will be coming down at a more rapid clip, and I suspect that relates to an improved economy. So if we have fewer eligible people, fewer people need the program. However, we are serving more eligible people in the program. The program is much more successful at reaching needing people, particularly low-income seniors and working families. Those are the groups that are participating at higher rates. I don't think we want to do anything to compromise those gains. So if we are now serving 85% of eligible people, hopefully we can continue to do better and in reaching underserved groups. So that will still be there. And what we'll see, again, if the economy truly does improve and heats up in a way that we'd all like, the program will be going to individuals and communities, as it always does, but those that most need it. And it will remain a powerful support for those families and communities. But hopefully there will simply be fewer folks who need it because the economy improves.
Thank you. Ms. Muth, talking about technology, you've talked about that in response to a few of the questions earlier. I'm interested to learn about the mobile app that you touched on and that your testimony mentions, the self-service side, with 1.2 million documents uploaded in 2014. I'm curious the rollout process, not only for the users, but on the staff side. Specifically, Ms. Dean talked about underserved communities, including low-income seniors. How have seniors responded to the online application piece? And if we have time left, I'll ask you about the appeals process and how that works within the interface. Go ahead.
Okay, so I'll start with the mobile app. Obviously, any of the technology tools that we offer are optional, so you don't have to provide information to us through a mobile app. But we did research to look at why are people coming into our office, and again, it's looking at, we have to be efficient. We're running a business, so what are those non-value added tasks, both for us and for the individuals that we serve, that are occurring? And a third of the people that came into our office were coming in just to drop off documentation, which then, as Ms. Dean mentioned, we image that so that information is available and we can distribute workload across the state. Well, there's a cost to imaging that document, so we thought, Well, if you're going to deposit a check with your bank, I no longer have to go to the bank. I can use a mobile app. I can take a picture, and that image is right there for the bank to process. And we applied that same concept to our mobile app, and it's a tool that's available. So the vast majority of people are still not utilizing the mobile app, but for those that do, it can save them a trip to the office, and it's efficient for the state because we don't have to pay our vendor to produce that image, and we don't have to touch the document. It's just automatically associated with their case. A worker gets notified, we've been provided this documentation, and they can complete that eligibility determination. So we really targeted, we built a business case around what things would be a value add both for the state and for the client in offering the product.
And as the use for devices goes up, then hopefully that piece as well, helping you reach your timeliness of responses as well. That was an interesting part of your testimony. Thank you so
Yes,
much.
absolutely.
Gentleman's time has expired. Thanks, Pete. Mr. Gibbs, 5 minutes.
Thank you, Mr. Chairman. Ms. Muth, I want to talk to you about something. In your testimony, you talk about SNAP balances and trying to expunge those balances. The reason I'm so interested in this, in Ohio, one of my local media TV stations did a little expose, and they found out we had some people on SNAP balances, some as high as $22,000, $23,000, and trying to figure out how to address that. So I see in your testimony you talked about that your agency requested and was denied a waiver to expunge the SNAP benefits on active accounts that have been available for at least 12 months. So do we need to pass some federal legislation, or some, what is Texas trying to do to address this balance issue, and what's your limits and limitations? What do you need exactly?
I believe it's a change in regulation that's required, and we must have had the same reporter move from Texas to your state, because we had a similar number of exposés which attracted a lot of interest. I think the limitation right now is we can, if an account is not an active account, you can expunge those benefits. But active accounts, we can't.
Okay, well, let me clarification. Inactive, what's the definition of inactive?
So if you use that account even once in that 12-month period, it's considered an active account. So that's sort of the limitation that we have.
So currently, if somebody hasn't used their account in a 12-month period, you can expunge those
That's
dollars.
Correct.
Okay.
Can I just jump in on, the
okay.
08 law is very clear that states can take the account offline after 6, and then they must expunge after 12, but it's the activity that is the issue.
Yes.
Okay.
I will say that, of course, to the extent that there's a problem, and the balances that you describe are clearly an issue, but where they're smaller amounts, states often find that it's senior and disabled households who actually don't know how to access their account. Maybe they thought they were supposed to get a second card in the mail. So what we'd like to see is to make sure states are engaging with the household on why aren't you using it?
Yeah.
And then, but obviously could revisit the expungement rule.
So, I mean, I think it would be reasonable to have some dollar amount, $5,000 or whatever. I don't know, what that is. I'm just throwing it out. And if it's been more than 6 months, the states could, I think it'd be reasonable to say the states can freeze those accounts and require those people to contact them and find out what's going on.
Yes, and USDA is encouraging that, but it's not obligated under the statute.
Okay.
And that's freezing and inactive. I think that it's also that question of what the activity levels are and the age of the how old those benefits are. So I certainly think there's opportunity to tweak how that's currently done today.
But another question, the obvious question, since you had this issue in Texas, well, I'm sure Texas and Ohio aren't unique to the country on this issue. It must be, nationwide. How in the world does anybody get those kind of balances?
And I think that's the big question that erodes the integrity of that. That's what our public asked. If you need SNAP benefits, I mean, obviously there's not trafficking going on in that case because they're accumulating very large benefits. But if you meet the eligibility requirements, why wouldn't you need to be utilizing those benefits? I think there are some situations, as Ms. Dean mentioned, where people might not be fully aware of the amount, but there certainly are a small number of cases where you see extremely large benefits that aren't explained by that explanation.
Well, you raised the question about eligibility criteria, parameters. Would you have a suggestion or recommendation, maybe that we need to dig in deeper to the eligibility to make sure that, I want to make sure that people that need the help are getting it. But, when you see balances like that,
Right.
and it's not, in the scheme of things, it's a handful of people, but
Right.
it's pretty good sized dollars in the aggregate,
Certainly we want to look at those cases for what's going on in that case from a red flag or an alert for potential fraud. I think the issue is less on the front end and more on what's happening in that individual case, because there's a handful of those, but there's really no logical reason for why you should have accumulated such
Now,
large balances.
would you agree with me that the states, since this program is funded 100% by the federal government, and then states kind of, at least in Ohio, administered through the counties, the states don't really have an incentive to really engage involved anyways. Is that typical in Texas too, or?
We have some skin in the game with the 50% of the administrative cost, and I think certainly in our state, our philosophy around the programs is that we believe that it's taxpayer dollars and whatever the source that we want to maintain the integrity.
I appreciate your testimony and bringing this to light, because we need to try to figure this out, so people that need to help get it. And I yield back. Thank you, Mr. Chairman.
Chairman's time has expired. Ms. Adams, 5 minutes.
Thank you, Mr. Chairman, and thank you very much, each of you, for your testimony. As many of you are aware, Congresswoman DeLauro and I are circulating a letter stating member opposition to SNAP being converted to a block grant program as part of any budget resolution. And so I would encourage other members to join the 60-plus members who are already on the letter if they haven't done so. Ms. Dean, the state of North Carolina has decided to stop all waivers for SNAP work requirements for able-bodied adults by July of this year. And while many states no longer have blanket waivers due to lower overall unemployment, there's still areas of the 12th district that I represent where jobs are just not available. What flexibility is North Carolina giving up by not requesting waivers for areas experiencing high unemployment?
Well, they're certainly giving up the flexibility to provide food assistance to very poor unemployed individuals, and they are limiting the flexibility of local food banks by increasing their increasing the number of folks who need to turn to them, taking, possibly having to ration food across more folks. But I think most fundamentally, what they're taking away from themselves is the ability to engage these folks in meaningful work programs, job training, and job search. Again, the time limit, the work rule under the time limit, which is very different than what Mr. Yoho was talking about in terms of employment and training, is a 20-hour-a-week engagement with no or very extremely limited job search. That's expensive for states to pull off, and I think they could much more meaningfully engage these individuals and help them with employment if they weren't facing the pressure of the time limit.
Thank you. In a written report by your organization, it mentions that the SNAP program already has a strong work incentive. For every additional dollar a SNAP recipient earns, their benefits decline by only 24 to 36 cents, much less than in most other programs. Families that receive SNAP thus have a strong incentive to work longer hours or to search for better paying employment. So how can we model the already strong work incentive for the SNAP program for other income support programs?
Thank you. That's a great question. I think Medicaid shares SNAP's work incentive in the sense of if you go to work or earn more, your benefits are not put immediately at risk in terms of health coverage, and that's very powerful. But other programs that are capped or where the funding is only available to serve 1 in 4, 1 in 6 eligible people, as someone gets a job, often very quickly the benefits could be taken away. Let's say someone loses a job. If you are receiving child care assistance when you have employment, and then you lose the job, child care could be cut off. But of course, that undermines your ability to go look for work and get another job. So I think taking a more holistic view of wanting to support and incent work and ensuring that we cover working families, but really the fundamental way to do that is by financing the programs, not capping them.
Thank you. Ms. Dean, we've discussed in previous hearings that many states do not offer a standard medical expense deduction for seniors and the disabled to document their true cost of living when they apply or recertify for SNAP benefits. In states that do offer a standard medical deduction, have you seen more seniors claiming the deduction in order to increase their monthly SNAP benefits?
Yes, and so this is a part of the program where seniors or people with disabilities can deduct their medical expenses because the cost of those expenses can obviously impede their ability to purchase food. So not all households, but just seniors and people with disabilities can deduct those expenses. It is actually a very complex area of the law, and when we look at the number of seniors on the program and who are claiming medical expenses, it's extremely low, much lower than you would expect. And it's just very hard. The statute's actually pretty complicated about what it takes to claim those expenses. So states have come up with a way to simplify it and make it easier to demonstrate that they have out-of-pocket medical, and the take-up there is great. That having been said, seniors need detailed, robust engagement. They need help through the process, and so what works best with them is actually supporting them through the application effort.
Okay, you've documented that SNAP benefits have consistently not kept pace with rising costs of food. So how would switching to the low-cost food plan permit those recipients to more adequately put food on the table through the end of the month?
So the Thrifty Food Plan, SNAP's benefit, the basis for which the SNAP benefit just assumes a very meager diet and heroic assumptions about how much time families have to cook, shop, and really extreme assumptions about what they're buying relative to the rest of America. A more realistic food plan, including the low-cost food plan, would just make more nutritious, healthy diets, put them within reach of families on this program.
Thank you. I'm out of time. Thank you, Mr. Chairman.
Gentlelady's time expired. Chairman of the Subcommittee on Nutrition, Ms. Walorski.
Thank you, Mr. Chairman. And hello to you, the two of you that have been here before. It's good to see you again. And as you know, I chair the committee's Nutrition Subcommittee, which has been central to the review process of past, present, and future of SNAP. So I want to thank you for being here and for returning for your second debut as well. Appreciate your expertise. One thing that stood out to me as we've been talking together and taking this comprehensive look at SNAP is that we're all in this together. Everybody's a shareholder. Federal government, state government, not-for-profits, private sector, researchers, recipients. Everybody has a role to play in this issue of lifting Americans out of poverty and onto the economic ladder. So no one has a monopoly on good ideas. In fact, state governments, not-for-profits, and the private sector are crucial incubators, and we've heard time and time again, crucial incubators of innovative ways to fight hunger and poverty. And flexibility does matter. It is important because it allows them to tailor programs to respond to the needs of their individual states. So my question, Ms. Muth, is to you. Our review of SNAP has shown the great value of partnering with all of these entities, the state governments, the private sector, the researchers, and all these folks, all the shareholders. And can you just talk about a little bit about the partnerships and the impact they've had when you're administrating federal programs locally, and then to what extent have you utilized these partnerships at the state level to maximize resources? And the positive and negatives of both.
Okay, absolutely. Well, I will talk about the private sector in the traditional sense first, and you know, we have a number of contracts that support our eligibility process, and as I was talking about, you know, EBT being an area that we have vendor support, and you're able to bring in the expertise of financial industry. That is not something that the state agency has, and so I think that those contractual relationships that we have for entities that support ours in the program bring new perspectives, and it's part of the whole program administration that we have in Texas. But we also have a large number of partnerships with entities at the local level. In Texas, we have about 1,500 community partners, and these are non-financial agreements that we have with entities who are already providing assistance to individuals, and they're providing assistance with things like the job search or helping address underlying mental health issues, or they're providing case management services, and so providing them access to SNAP is one of the tools in their case management toolbox. So we partner with those 1,500 organizations. So for those individuals, they used to bring us paper applications for them. Today, they're community partner sites, and they make the online application, the mobile app functionality available to individuals across the state.
And when you're partnering, and so, and you're sending then all those resources down to the front line, And it sounds like you're doing what we've heard about and what we've been talking about, this holistic approach. So when somebody does fall through so-called safety net, then basically your partnerships, if I understand this correctly, are basically there to make sure there's an underlying net that makes this program then run more efficiently. I mean, prior to the partnerships, do you know, do you have data that you can look at and say, wow, since we've been partnering with all these agencies, look how much more efficiently we're delivering this, or look how much better holistically we're taking care of families? Is that true?
I don't have data to indicate
Yeah.
that. I think those partnerships existed. It wasn't really a partnership. There was a relationship. And it became really clear to us in Texas when we had significant delays in processing eligibility, because food banks came to us and said, while it's taking you this long, we can't keep food on the shelves because people are coming more to us. So there's a natural relationship there that we just sort of formalized in those partnership agreements.
Okay, I have one quick question. You talked about the most common SNAP household recipient is female between 18 and 49 with kids under 12 years of age, has some form of income, receives a monthly benefit of $274. Can you recommend to this committee what you think would best assist the majority of this population? What is the best thing we could possibly do if we could make a move to assist that woman?
I think part of it is just changing our practices and not expecting everybody to be able to arrange for childcare and transportation and time off of work to come into those eligibility offices, and having the convenience of technology so that they can provide information to us, contact us 24 hours a day, 7 days a week through the online self-service.
Okay, I appreciate it. Thanks, Mr. Chairman. I'll yield back.
Gentlelady yields back. Mr. Costa for 5 minutes.
Thank you very much, Mr. Chairman, and I want to welcome the witnesses and thank you for being here. Members of the committee, I'm sure as you're aware, I believe this is the 12th full our subcommittee hearing that we've held on the Supplemental Nutrition Assistance Program, otherwise known as SNAP, in the 114th Congress. Each hearing has had a distinguished panel. And what I'm trying to determine is what the objective is why we've had a preponderance of hearings on the SNAP program. And I must admit that I'm increasingly concerned about the potential intentions as it relates to the future Farm Bill. I'm concerned that there's going to be a policy recommendation to leadership that in the next Farm Bill we dramatically cut SNAP, and I think there should be adjustments as it relates toward it. But I don't think we ought to be throwing the baby out with the bathwater, no pun intended. My district is one of the richest agricultural districts in the country, but it also, with that significant wealth, has a lot of poverty. And it would be devastating and directly equate to taking food out of the mouths of children and families in my district. And of course, the irony is a lot of these folks are some of the hardest working people you ever met in your life, who are working to produce the food that goes on America's dinner table. And many of them are out of work today as a result of the drought conditions and the regulatory programs that have compounded the drought conditions. California, San Joaquin Valley, which I have a pleasure of representing, has an unemployment level that is nearly twice that of the national average, of course, according to the Bureau of Statistics. As it stands today, I sadly must tell the members of this committee and the witnesses that there are 50,000 plus households receiving SNAP benefits in my district. The statewide snapshot of SNAP in California indicates that there are 278,000 households that are receiving food stamps in California, and 50,000 of them are in my district, almost 20%. 79%, if you want to understand the snapshot of those households, have a child that's under 18, 79%. And 15% of those households have one or more persons that are 60 years or older. This is a dramatically impacting the valley, obviously because of a combination of other factors, as I stated earlier. Fields are being left unplanted as a result of the drought, and jobs are at a premium. Now is not the time to be considering, I think, taking food away from families in the San Joaquin Valley or throughout the nation. Are we satisfied with the status quo? Absolutely not. Are there alternatives to dealing with this? Yes, and let me speak of one. My friend Pete Weber, who's taken the leadership with local governmental agencies, has formed the Fresno Bridge Academy in my district, and it's one of several programs around the country that's taken advantage of the 2014 Farm Bill in terms of employment and training pilot program that I urged very hard to make a part of that Farm Bill to reduce dependency. One of the last graduating classes at the Bridge Academy saw 77% participating SNAP clients come from unemployed to becoming employed. 18 months later, 83% of the clients had obtained employment or job advancement, and 32% had achieved self-reliance. I believe states' best options are to develop and fund innovative programs like the Fresno Bridge Academy, designed specifically to truly help people move to independence. That said, my question is, with all due respect, is what are we doing, or what are the efforts intended to be with this committee and the outcome of these hearings? So finally, Ms. Stacy Dean, I would like to ask, what can states do to develop additional programs like the Fresno Bridge Academy? Because clearly we want to get people off assistance, we want to get people independent and self-reliant, and I think that ought to be the goal and the intention, regardless of how many hearings we have.
Well, I don't mean to joke too much, but actually cloning the Fresno Bridge Academy would be terrific, because I think not every state has such a terrific local partner that runs such a high-quality program. So finding ways to replicate is important. I think USDA actually just announced in the last day or two that they are providing more robust technical assistance for 10 new states to bring up their employment and training programs. I say bring up, they actually have employment and training is significant, but a lot of it's focused on job search and workfare, and not
actually getting people into the jobs.
Right, and giving them the support and intervention that they need to move up and up into the workforce. So cloning first, but then more learning.
Thank you very much. My time's expired, Mr. Chairman.
Chairman's time expired. Mr. Allen, 5 minutes.
Thank you, Mr. Chairman, and thank you, our distinguished panel, for being here and talking about this important program. Obviously, we had tremendous growth in this program, and now I see that we're making progress as far as reducing the number of folks on this program. In fact, I was with a group yesterday that are involved in a food pantry program, and one of the concerns that I had and this is in South Georgia, that they serve about 3,000 children, but there are another 56,000 children that they think that might not be served. And then the other thing that I thought was important was that those 3,000 children served, all of them have so far gotten a high school education through the food pantry program. Are there similar programs, and I'll just throw this out to the panel, do you see the potential as far as changing the cycle through education and then obviously moving these folks onto the workforce and then getting them off this assistance?
I think absolutely there are a lot of programs around the country, and much of that occurs at the local level, where organizations are having that direct contact with the families and provide more. And we talked a little bit about they have the ability to provide a little more of the holistic case management to identify the underlying needs of the family, and SNAP being a tool in the toolbox to assist them on that path to self-sufficiency.
Are there any statistics out there that you have as far as the SNAP program and then the ability to, well, we know children, and your testimony here has provided that children do better in school and socially, if they're not hungry. So what are your trends showing as far as the impact that you're having on children and their ability to get a good education and then to get a good job?
If I may take that one.
Yes.
In my testimony, I summarized the results of a recent study that was published that took a look at SNAP when it was being rolled out in the late 60s and early 70s. It was the only time in history where we could compare children who, as young children or while their mothers were pregnant with them, received SNAP versus did not. And when you looked at the long-term outcomes for those individuals who were able to participate in then food stamps, it's really astonishing. High school completion rate was 18% higher amongst children who were there when they were very young, were able to participate in SNAP. That's an extraordinary outcome for a basic food benefit for young kids. And similarly, their health outcomes were also impressively much better off than those who did not. So I do think it's very important to think of this as a long-term investment in education.
Mm-hmm. As far as the your statistics go, I mean, obviously, the longer you're on these programs, the more dependent you are. And what are we doing? I mean, obviously, we're seeing progress with our children in doing the right thing as far as making sure that they're fed, that they have the ability to get their work done, and then, like I said, move out of this cycle. But do you see any potential as far as older folks and what we're able to do to move them off these programs?
Well, the individuals who participate in SNAP, it's a very dynamic group. The majority of folks experience a temporary downturn in their personal circumstances. They use the program and they move on. They get that job. Their family situation improves. Their child is no longer sick, whatever the situation is. That's a very dynamic group. There's also a group that is simply earning wages that are very low, or a senior who has a Social Security benefit that we cannot expect to increase. The 70-year-old is not going to earn more funding. We have to think about them differently.
Just about out of time, but obviously the economy has not been robust for some time now. In fact, it's the longest period of stagnation in some time. But obviously, you see a big difference when we have a growing economy and the wages are growing and people are able to move up into higher wages and then eventually become independent. Would you?
Absolutely.
Okay. All right.
Absolutely.
So we just got to get the economy growing.
Just that.
Okay.
Right.
I'll yield back.
Gentleman's time has expired. Ms. Kirkpatrick, 5 minutes.
You know, Arizona is one of the 6 states that has a full ban on noncompliance with drug testing. And I just would like your thoughts about what that does to families in Arizona. I don't know who wants to answer
You're
that.
talking,
Whoever wants to
We're
answer.
talking about drug testing in the cash assistance.
That's right.
Well,
there are 6 states that have a full ban. Right. Arizona is one of them.
I think, first of all, there's a question to the state in terms of the cost of the drug testing, given the very low positive results that are found. And I think several studies have found that it's an extremely expensive policy for what is found. But I think the real question is, what's the purpose of the drug testing? What we don't necessarily see is withdrawing cash assistance or fundamental support from extremely poor families, because Arizona's cash assistance rules are pretty strict. Withdrawing funding from that family and basic support, are those children better off? Is the individual with a substance abuse or addiction problem getting the help that they need? And I think that's the measure of success, and not something that we're necessarily seeing in the states that have applied the test.
And hunger is a real problem in Arizona. We have a higher incident rate of hunger among children. On the Navajo Nation, over 75% of the people suffer from food insecurity. So I'm really pleased to see that Arizona has been selected to receive the specialized technical assistance to improve their SNAP ENT program. And my question is for Ms. Dean. Can you explain how this program will help Arizonans get SNAP back to work?
So this is what I just mentioned. I believe it's what I just mentioned a second ago. There's a organization in Washington, Seattle, Washington, called the Seattle Jobs Initiative that has a pretty amazing proven track record in opening up workforce training programs to very poor individuals and families. Traditionally, a lot of the workforce and job training programs run by labor departments can be closed off to some of the poorest families and the ones most in need of that basic training in order to move up the economic ladder. And so, but the Seattle's Jobs Initiative seems to have cracked that nut. And USDA has contracted with them to offer technical assistance to states outside of Washington who are interested in finding a way to design programs that work for the SNAP population that they most want to help. So appropriate to local conditions, appropriate to the individuals that they're selecting, because I think we think about moms with enormous barriers to work quite differently than someone with a deep job history. You would just go about helping them differently. And of course, responsive to local conditions. Are there jobs there? Are they talking to employers about the skills that are needed? So this program's been terrific, and we're thrilled USDA is offering their help to 10 more states, and I'm glad Arizona's one of them.
Thank you. It really is about jobs. It's all about jobs. I was happy to hear the idea about using technology to allow them to get online, to make their applications and supplement their information. Here's the problem I have a huge rural district in Arizona, much of which does not have broadband coverage. And so is there anything that you're aware of that's being done to address that?
We certainly have similar issues in Texas, and while I don't have the answer for that, I think over time that's becoming less and less of an issue. But while there's not immediate answers to that, it's still an option. It's not the requirement, but I think that most people, it's an option that most people would like to take. And so we've definitely seen a big difference over the past 10 years in Texas, and I look forward to that continuing to improve in rural areas.
We're seeing some progress, but still a lot of work to be done. It's a top priority of mine for many reasons. So thank you very much for your testimony today. I yield back.
Gentlelady yields back. Mr. Newhouse, 5 minutes.
Thank you, Mr. Chairman. Ms. Muth, Ms. Dean, Ms. Cunningham, thank you very much for being here and discussing this important topic of finding different options available to states for implementing SNAP. I think I've got a question for each one of you, so 5 minutes goes by really quickly. I just wanted to, first of all, talk about, and I thought it was for Ms. Cunningham, but maybe Ms. Dean, since you brought up Seattle. I'm from the state of Washington. As you know, we have a very robust SNAP employment and training program. It's known as the Basic Employment and Training, or BFET. It's a collaborative public-private partnership that provides a range of skills to SNAP beneficiaries, things like advanced employment, interview help, education skills, even down to what's the proper workplace attire for people that are looking for work and other things. It's been very successful from, I think, April 2011 to December 2014. It has more of a, I think, a 65% success rate of helping people find work within 24 months at fairly good wages, actually, comparatively. So whoever could contribute to this, could you discuss the range of E&T options that are available to states, and ranging from fully funded federal programs to the 50-50 program match funds? And also, do many states take advantage of that 50-50 match program? And also, not to tout our own program, but can you give me a sense of which states have a better rate of helping SNAP beneficiaries find work?
Do you want me to? Sure. So you should tout this program. It's terrific. We really think it's a shining star amongst the state offerings. But it took Washington, with a very concerted and focused effort, several years to sort of figure out how to open up, again, these broader workforce services to the SNAP-specific population. I think what distinguishes the program in many respects, and I should say USDA sends many states to go to visit to Washington. They run an annual training for other states who are interested in how to do this. One is thinking about who are we targeting. Again, individuals who are temporarily unemployed versus someone who's been out of the workforce for years, may have folks with different educational ranges, and also where they live and what jobs are available. Thinking first through who am I focused on, and where are, what types of services do they need? And is there a match between the services this individual needs and what's available in the community? Individuals are also allowed to volunteer. They are working with highly motivated individuals who want this help. So that has a lot to do with the success rate, because they're motivated and there's a great connection and a service that's appropriate for the individual. So your broader question about what do we know about other states' programs, actually very little, and that's why it was so terrific in the 2014 Farm Bill that the committee, along with some other changes that it made to employment and training with the demos, required that USDA work with states to set up performance metrics so that there would be more regular and routine reporting out appropriate to what the state was running, not consistent across all 50. So we'll have a better sense of what's working well. Most states run job search and workfare, and most states use their federal funds and some 50-50 funds, but they do not leverage as much as they could.
Okay, thank you very much. And I don't mind you singing the praises of my state, but they are doing a good job, so I appreciate you saying that. Ms. Muth, the current Farm Bill included a pilot program known as the Food Insecurity Nutrition Incentive. The grant program is intended to help SNAP beneficiaries obtain access to fruits and vegetables. I know that I think I've heard the San Antonio Food Bank received a grant last year. Can you talk about the rollout of this program and its impact on the nutrition outcomes for SNAP beneficiaries?
I'm not familiar with the details of the program, since that is a relationship directly with the San Antonio Food Bank and the USDA. But I will say that's an issue of great interest from everyone within the state, from the community-based organizations to even retailers in Texas are interested in how we incentivize those nutritious options for SNAP recipients.
Okay. Yeah, just interested to see how well it's working around the country. But like I said, 5 minutes goes by really quickly, so I appreciate all of you being here and contributing to this conversation. Thank you. Thank you, Mr. Chairman. I yield back.
Chairman yields back. Mr. Nolan, 5 minutes. Mr. Benechek, Dr. Benechek, 5 minutes.
Thank you, Mr. Chairman. Well, welcome. Thanks for being here. Many of my constituents ask me the same thing every time we talk about SNAP, okay? And I'm just going to, the work requirement, fraud, and how do somebody transition out of SNAP when they get a job? So those are the three things that come up whenever I speak to constituents or when they bring it up to me. And I understand some of the questions that are brought up, but somebody wants to work but can't find a job. The people that I talk to are concerned about the people that don't want to work but are staying on the job. How do we differentiate that? I mean, and what are the things that we could do to help people that actually want to work be still eligible for the program? Can you talk about that? Ms. Muth, what are they doing in Texas?
Well, in Texas, the work portion of the SNAP program is administered by another agency, but I do think that most of our recipients do have some type of employment, and for those that don't, there are requirements that they participate in and the time limits, and Ms. Dean may be able to give you a better picture of that from across the state.
Ms. Dean, do you have any input there?
Sure. Well, first, the program's eligibility rules allow low-wage workers to participate in the program. So, for example, a family of 3, their monthly gross income needs to be below about $2,200 a month. So there are many, many families who are working and participating in the program. My colleague just reminded me that about 87% of families are either working in the year before or the year after with SNAP participation. So it's not just while they're on the program, but we have workers who are in and out of the workforce who then avail themselves of the program. So there's a high connection to work for folks on the program. But I think I just want to spend a minute or a second, given the time, also just calling out that we do have a growing number of extremely poor families in this country, the folks who are living below 50% of the poverty.
Well, no, I'm all for the people that are really poor and who are unable to find work to to access the program. That's why we want to be sure that there's enough funds to help those people, but not, the people that I talk to see this all the time, where people are turning down work to stay on the program. So, how do we sort that out?
Well, I think we constantly, in this program, fight the individual anecdote, but I will say, the data
Well, but
really does
I
support
talk to
that there are
restaurant
many,
owners,
many
for
people
example,
working.
that are looking for waitresses. Can't find a waitress. That seems like a pretty good entry-level job for someone who doesn't have a job, but they can't find a waitress who's willing to stay for any period of time because they lose their benefits. So I'm trying to figure out, how do we make this work so that people who...
They lose their benefits, meaning they're concerned.
Well, I don't know exactly why they're not taking the job, but they don't stay on the job.
Right.
Okay, so, there are some employers that are looking for, a waitress is a skilled job, I think. But I mean, it's a job that someone could learn and be good at without a lot of formal training. And to me, it seems like a good access to the workforce job. So how do we make this easier to determine whether you can't get a job or you don't want a job?
Well, I think that is the incredible challenge. Certainly, doing more to connect available jobs to SNAP employment and training, to making sure that the folks on SNAP are not, the employers are telling SNAP where the jobs are so that participants know where their jobs are, is one step. But it is difficult. The individual you're talking about, someone who is work avoidant, could appear that way when in fact we also have many individuals who are homeless, who do not have childcare, who might not have a cell phone.
But I mean, that's not the case of the people that I'm talking about, because I mean, I talk to people a lot in my job because I go around to the district and talk to people about what their issues are, and it's not what you bring up, okay? It's not anecdotal, it's a real problem. So I want to see that needy people get the good, make it work, but we haven't come up with a good answer here in committee about this sort of problem. And unfortunately, I'm out of time. The 5 minute goes really fast.
Gentleman's time has expired. Mr. Lamar, for 5 minutes.
Thank you, Mr. Chairman. Just as a preface here, concerns expressed earlier in the committee about, again, the reason for these hearings as being like a prelude to in the next farm bill that, making cuts to the program, and, that's kind of not helpful in what we're really trying to do. Our job here is, a big part of our job should be and is government oversight of any program or government operation, whether it's this committee or defense or any other committee's venues. So, we're just looking for solutions to make any program go better and help the people that are the beneficiaries and users of it benefit more and, better usage. So I don't enjoy that gets spun into other things sometimes. So we want all of our government customers as we serve them to do better. So that said, Ms. Muth, in our review of SNAP so far, this committee has learned a lot about the value of public and private partnerships and their impact they can have on when administering a federal program at the local level. So has this been utilized fairly widely with regard to SNAP in these partnerships, and what do you think, what are the things that might be improved or made more useful by the public-private?
I think both in public-private partnerships, we have a number of partnerships, and sometimes I hate to call a contractual relationship a partnership, but we contract with a number of private companies that play a role in part of the SNAP delivery. So as I mentioned, EBT would be one area where we are able to draw on expertise, financial expertise that we don't have within the state. And then we have a number of partnerships that occur at local level with with a variety of organizations. We're a big state in Texas. We are a state-administered program, and so sometimes as we sit in Austin, we're far away from what's happening in those local communities, but when we partner with organizations...
The Texas delegation's always reminding us how big Texas is,
Yeah,
you know.
I know, we have to. And so I think, we've done a number of things. I mentioned the Community Partner Program. We also have a partnership with the food banks in Texas, and we do have a demonstration waiver with USDA where food banks are able to do some of that initial data collection.
So, I'm sorry, the time thing's
Yeah.
always, but, so by and large, it's pretty positive. Right?
Absolutely.
And, using local infrastructure and, bang for the buck and getting it to the ground is quicker and more efficiently is good. Is there any downside with the work at that level with the federal interface?
I think there are some limitations at the federal level. The demonstration waiver that we have, I think we're one of 3 states that has a similar demonstration waiver to allow the food banks to do that data collection and have that count as the interview process. So there'd be an opportunity to look at if that was worth expansion.
Okay, good. Thank you. Ms. Dean, I'm California. It's another pretty big state, but we also have those waivers that allow the on-demand and telephone interviews in lieu of a scheduled face-to-face interview, which in determining eligibility and research. And so, as was mentioned earlier on, the flexibility allows the resources to be utilized more efficiently in other areas, stronger verification. And so, but sometimes, I wonder how much value is there that direct communication might have in the interaction with the recipients, so that they're getting what they need, and B, you're having maybe the cues you pick up from that interaction and determining either eligibility or recertification. How important is keeping the digital process, but also having the integrity of the program with that face-to-face interaction? Is that a flexibility that is needed one way or the other, more so?
So the state is held to the same standard for accuracy, whether the interview is over the phone or in person when they're re-reviewing their cases. And I think this was an area where there was a lot of trepidation early on. Could we have a robust interview? Do you need to look someone in the eye? I think that and Ms. Muth can correct me, but I think that states have really had a very positive experience. They've learned to interview differently over the phone. One of the nice things also that technology has afforded is at the same time telephone interviews were coming on, many states can now pull down real-time data about the household. So I've sat in on interviews where the client says, my child support payment is no longer coming through. And the caseworker now can pull up child support data and say, well, wait a minute, I saw that information was posted for February. What do you mean it's not? So there are other tools that have expanded at the same time we move to phone interviews. So I think it's been terrific. States can always, if they're concerned, pull the individual in, and if the individual needs help, can also go in and ask for that face-to-face help.
Gentleman's time has expired. Mr. Thompson, 5 minutes.
Chairman, thank you, ladies. Thank you so much for being here, part of this panel. The SNAP program is a very important program. There's no doubt about it. But it's a very complex program because people bring all kinds of different histories. We have folks who are sort of intergenerational poverty. We have people who just wake up in the morning, find themselves in bad times. We have people experiencing mental illness, maybe substance abuse, those who are incarcerated. It's so complex, and I think that's why it's difficult to find one solution. One solution is not going to work on that. If we do a cookie-cutter solution, at the end of the day, with our reauthorization of SNAP, we have failed. We've failed a lot of Americans. I prefer to see SNAP actually as the purpose of it is not so much a program, but a pathway. A path that works in a functional way to lift people out of poverty, to achieve greater opportunity, to provide a means for upward mobility. I'd obviously put SNAP in with a whole lot of other programs that we do that don't do that today, that tend to keep people down and suppressed, and they never realize the American dream. And so I'm going to go down a path that we haven't asked a lot about. and Ms. Dean or whoever will respond, I want to look at the, obviously, and correct me if I'm wrong, but my understanding is that the eligibility for SNAP is generally at or below the 130% of poverty line. Family of three is about, well, it's calculated $26,100. Now, that's according to October 30th, 2014 rule. And we know that when we talk about, or I talk about, and I hear others talk about, that we've got a crisis, a savings crisis in our country. That families have that insulation, that so when things go bad and you have a bad day and you wake up and you lose your job, or you go in the hospital, or your kid gets sick, or the furnace goes out, we really have a crisis in savings. And so what I want to ask you about actually are the household SNAP resource limits, because they ought to be adequate so that and those are my calculations are $2,250 in countable resources, $3,250 if you have at least one person's age 60 years of age or older or is disabled, but that's household. And now certain properties exempt, my understanding. Most cars are exempt. That's a bit arbitrary state by state, a lot of variability. So my question is straightforward. Are these limits adequate without further economically destabilizing the households in question?
We do believe that the federal asset rules are too restrictive, that, as you put it, I think, exactly as I would have, which is that if you cannot accumulate some modest savings, you can't inoculate yourselves from life's ups and downs. If my hot water heater breaks, my car breaks down, and that financial stability, that personal insurance of some modest savings is what can help prevent families from falling deeper into poverty. So I completely agree, and that really is one of the main drivers for why states have taken advantage of the flexibility to relax that asset test, to allow for families to accumulate some modest savings, which was a very bipartisan goal in the 2002 Farm Bill.
Okay. It kind of brings us a natural transition to my next question. Ms. Muth, you have discussed, you state that it is important to maintain some consistencies between states when implementing SNAP because benefits are portable across state lines. Those in border towns are especially impacted by the inconsistencies between states. I represent 24% of the landmass of Pennsylvania. I have crossed the northern tier. What are some existing options that might make it difficult for recipients and state to maintain consistency across states? What should we do about that?
I don't see any current barriers. I think in Texas we have a lot of people that are either come shop in Texas or we're shopping our SNAP recipients are shopping at other states. I think the issues that might come about was if there were different rules that applied and that the retailers were enforcing different rules for whether you live in Texas or whether you live in New Mexico, for example. But today, I'm not aware of any issues that we have with our clients who are shopping across state because it's fairly consistent.
Very good. Thank you, Chairman. I yield back.
Chairman yields back his extra time. Appreciate that. Ms. Lujan Grisham, 5 minutes.
Thank you, Mr. Chairman, and I appreciate the panel and the dialogue because as we try to figure out how we protect those families and support them to make sure that this benefit is available to them so that we don't have any hungry families and any hungry children, but we're also looking at getting folks into a situation where they're not dependent on these benefits, I think is a healthy dialogue. But I can also see how it can go awry. And I talk about it a ton, frankly, in this committee, that the intent of Congress to allow states to have more flexibility in how they operate SNAP and related programs is to really ensure that those states can target the constituents and those families in a meaningful way and to take in the unique circumstances of each state so that they could administer those programs. But I get very concerned when that flexibility, and I'm an old state bureaucrat, I loved flexibility and was usually arguing with the federal government, but when that flexibility can be utilized in a way that does exactly the opposite of the intent of the core program, I really want to talk about what safeguards there are. And so here's the example. In New Mexico, half of the SNAP benefits go to children. 1 out of every 3 children in New Mexico is at risk for hunger. It's the 4th highest child hunger rate in the nation. So we're still identified as one of the most hungry states in the country. Our unemployment rate is the highest in the country, and it's steadily increased for the last year. In fact, our economic situation is so dire that there is, it has really created apathy and an environment where I can tell you that most bipartisan state leaders are not finding a way clear out of this economic predicament. However, in that environment that I've just spoken of, our state, the governor, has unilaterally reimposed very restrictive work requirements on SNAP recipients, even though there are no jobs. It's also the only state in the country where we're losing population because there are no options. So we're going to, I believe, you see children and families who are not intended to be off this benefit at this time will be kicked off. And in fact, the recent estimates are up to 80,000 New Mexicans will lose their benefits due to those job requirements to find jobs that frankly don't exist. So how do we reconcile that? And what can, Ms. Dean, what can Congress do that assures that flexibility doesn't become a tool to restrict the benefits that were intended to shore up these poor families and take care of these poor children?
That's a big question. Can I, just when you're talking about work requirements, do you mean the time limit or work requirements on families with children? I just want to make sure.
It's both.
That's what I thought. Okay.
Unfortunately.
So first off, I think one of the key things that the statute does that you all have done in addition to the regulations is knowing that states have choices and options. There are some key parameters that if you want to, for example, do online services or talk to people in person, those kinds of things, you still have to process benefits. Once someone presents themselves as needing help, if they are within the federal timeline. So timeliness and accuracy are key metrics that the feds hold states accountable to. And they say, you've got a lot of different choices and options, but you must help needy people when they present themselves and provide all of their information. Those are cornerstones to the program and really help identify where there are problems.
Do you think we could strengthen those cornerstones? And again, I believe in state flexibility. I also want these benefits to be targeted in a meaningful way, and I want real opportunity so that we don't have persistent poverty. But I also know that this safety net is critical. And it is clear to me that too often the federal government finds that those resources seem a bit restrictive to them to actually do accountability. And I get lots of responses that say, well, you know, they're within the work requirement regulations, so we aren't going to do anything about those 80,000 who are now off.
Right, and I think that's the key question can there be, when there are work requirements, when the state is saying we want to engage these folks in some activity to test their willingness to work and hopefully to encourage work, is what's the measure of accountability there? Leaving the program doesn't mean you got a job. It might mean that you were asked to do something you couldn't do. There was no child care for your young baby. You might have, you know.
No jobs in my state.
Or no jobs. And so what do we do to ensure that those efforts are engaging in the results that everyone says they want?
Thank you.
Your latest time expired. Mr. Davis, 5 minutes.
Thank you, Mr. Chairman, and thank you to each of the witnesses for being here today. A lot of my questions were taken by earlier members of this committee, but I think it's imperative that I reiterate some of the comments that Mr. LaMalfa made. You know, I really want to commend Doug and also Chairman Conaway and the chairman of the Nutrition Subcommittee, my colleague Jackie Walorski, for actually talking about SNAP and bringing folks like each of you in to talk about some of the successes of the program, because we would be keeping SNAP recipients in states like Texas and my home state of Illinois. We would be doing them a disservice if we didn't try and make the program even better and more respective of the needs of those families who are utilizing those benefits. A lot of talk about public-private partnerships. That was my question, but I don't want to reiterate it again. Although in one aspect, based upon some of the discussion here today, we seem to focus those public-private partnership discussions on more urban areas. And I know that there are many urban areas in the great state of Texas, as my chairman likes to remind me of. But I have a lot of rural areas just like you do in Texas. Can you expand maybe, Mrs. Muth, on what opportunities for rural areas there can be for the public-private partnerships?
We do have public and private partnerships in both rural and urban areas. Obviously, in some instances, it's harder to find the partnership in a rural area because there's just not as many entities there, but we have a very successful partnership with the food bank in Lubbock. They participate in that demonstration waiver that we have, and they target rural areas to provide access to individuals in those areas. And so I think it's incumbent on the state. We often look at that issue, and those are where we work very hard to identify and recruit partners, and sometimes we have to work a little bit harder to do that, but they're there, and we do have those partnerships that are very fruitful. We work with the faith community as well in those partnerships, and so I think that's an opportunity in rural areas also.
Great. I know there's been a lot of discussion on technology and technological advances and getting more of a coordinated effort for our states to be able to serve the recipients of SNAP benefits and other benefits to work together. I know there was some discussion about that just a few minutes ago. Is there anything that you may want to relay to this committee we haven't asked about how to make this technology work even better and in a more cohesive fashion to better get the benefits to the recipients? Whomever wants to answer.
I'll take one because I just had a thought that had come to me, and Stacy, you might remember the name, but there's a partnership right now with a number of states. One of the things we have to do is confirm whether someone is receiving benefits in another state, and each state has to individually contact other states. And there's a partnership with a number, I think it's 7 or so states right now. It's something that states have to buy into, to participate in, that just really seems like there should be a national database so we're spending a lot of resources, and I will tell you, because often workers in other states somehow get my name and number to confirm whether a recipient is receiving benefits in Texas. It's not an efficient process, and I don't think it's an effective process, and technology could really help us there.
Okay.
Can I add one more?
Yeah, absolutely.
Which is, I think the procurement of large statewide systems, that I think many states, particularly small states, are largely left on their own to sort out how to undertake a large procurement with, and can often be multi-billion-dollar companies, and sometimes, frankly, are just mismatched in terms of knowing what to ask for, how to ensure the contracts will get them the best that they can. And the best value for your investment as well, because the feds are putting up a significant share of those funds. So I think finding ways to leverage information across states and perhaps to collaboratively purchase if 8 states are working with one vendor, there must be some way to leverage their shared.
Is the USDA providing any of that type of technical assistance?
Well, it's not just USDA, because most eligibility systems will include Medicaid, child care, TANF. So it's a multi-federal agency, a multi-state agency, and I think a lot of efficiency is lost in that effort.
Great. My time has expired. Thank you all.
Thank you, Ms. Davis. Had a couple of real quick ones to finish out. Ms. Muth, you mentioned that Texas has a 96% efficiency rating on getting things done on time, or getting benefits qualified on time. What's the definition of on time?
So there are federal standards related to timeliness, and for applications, there's generally a 30-day time frame in which we have to process that. But if a household meets expedited criteria, then we have to process that in 7 days. But Texas actually has state law that says if you meet that expedite criteria, which basically means you're in immediate need for assistance, that we have to process that by the next day.
Okay.
So on average, it takes us about 14 days to process applications.
And the 96% is a blended approval rating on
That's
all
correct.
three,
On all of
37, 14.
that's correct.
States share the administrative costs. Are there a CPA by trade? So are there efficiency standards or measures that have been developed or are developed to look at number of employees per beneficiary, dollars spent per beneficiary, all those kind of things that would lead us to believe we've got, on the administrative side, we're getting the best bang for the buck, and then help states who may not be providing the same level of their half. In other words, they're limiting their access to these better technologies through a state decision. Are there ways to look at that from an efficiency?
That's a great question. The USDA does publish the administrative cost, but it's so difficult because every state is organized a little bit differently and groups programs together differently. And if you have a major,
would there be value in looking at some common denominator that you then? I mean, dollars is one thing, but if we had dollars against number of beneficiaries, dollars against payments process, I mean, some sort of way to look to see which states are doing it better, and then say, well, other states, here's a state that's doing it better.
Absolutely, and I think also at the state level, they hold us accountable through the appropriations process as well.
All three of you, are there, and Ms. Dean, you mentioned it really in answering Mr. Davis's question, but are there formalized best sharing convening organizations within 50 states or 54 jurisdictions, whatever we have that separate this deal, that so that they can look, small states can get together and see how they do it best, and sharing best practices across this scheme that would be beneficial?
Sure. So there is a state-based organization, the American Public Human Services Administration, and they're here, which is great. States are members of that convening organization, and they get together and gather. The feds also pull folks together to share, not always across program, not always with respect to a business approach or a method of doing work, which states would care about that across SNAP, Medicaid, TANF, and child care. We tend to think within single programs. So I think there's more we can do there. And frankly, states and the federal agencies, I think, feel constricted on their ability to convene and travel because there's a lot of public scrutiny of spending dollars in that way. But it is so important and so valuable. We need to see more of it.
All right. The 20-hour work requirement, that's not just one job. They could have multiple jobs to get to 20. Okay. And then this is probably outside y'all's lanes directly, but can you walk me through real quickly the interrelationship between qualification for SNAP and the school lunch program, the school nutrition programs, and eligibility there? Or is there a link between those?
Yeah, absolutely. Children on SNAP automatically qualify for the free school meals program, and there's a legal obligation for states and school districts.
That's lunch
to
and
cross-enroll.
breakfast?
Yes, there's a requirement to cross-enroll and a performance standard there.
Okay, and then is that the only way children qualify, or can they still qualify for free and reduced lunch if they come off the SNAP program?
Yes, they may fill out an application and qualify based on family income.
But SNAP just automatically gets them.
Absolutely, yeah.
Right. Well, I appreciate our witnesses being here today. We get criticized for the number of hearings we've had on this issue. We spend $80 billion a year on it. I'm not embarrassed by the opportunity to present, hopefully in a fair, balanced method, so to speak, the good, the bad, and what we're trying to get done. My goal is to get the policy right. I don't have any numbers to any savings, anything like that at this stage. We just want to get the policy right. You can't know that unless you have the examination of the policy to see what's working and what's not working. And so I appreciate you being here today. As Mr. Thompson mentioned, we serve 45 to 46 million people. There's not a 30-second pithy little snippy statement that captures adequately the complexity or the system. One side, our side, typically focuses on the anecdotes that folks who are otherwise, the ones that, excuse me, that Dr. Bittershek were trying to get at. Pardon me. We focus on the 27-year-old surfer, California, who not a lot of sympathy there for being on food stamps and maintaining his surfer lifestyle. Mr. McGovern and others focus on the folks who will always be on benefits, the children or should be, elderly, disabled, all of those. And so we talk past each other an awful lot of time when we're trying to deal with this thing. So our goal, publicly stated, is to make sure we get the policies correct, and then we'll score those policies to see where what we can afford and all those kind of good stuff. But the real goal at this stage is to get those policies right. One of the things that goes on, if I'm a private donor in a not-for-profit or a faith-based organization and they don't do it correctly, then I can police that and move them out. These programs are not policeable by the donors, by the taxpayers per se. And so that's a job that we should be fulfilling, and we haven't for a long, long time. So some of the, we're building a body of knowledge that this group didn't have, because for a long, long time we just let this system go and without a great deal of understanding. So don't apologize to my colleagues who criticize us for having too many of these hearings, but I want to appreciate our witnesses for being here. Under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplemental written responses from the witnesses to any question posed by a member. This hearing of the Committee of Agriculture is adjourned. Thank you.